NPM1 is mutated in approximately 30% of patients with AML, and it's one of the mutations that defines favorable risk by the ELN 2017 criteria, and in fact, also on the updated ELN 2022 criteria as well. So we also know the mutations that are highly specific for secondary AML, including 8 that was reported by Lansley and colleagues, have been shown to have poor prognosis. And, there's not a lot of research or information data on what happens between these NPM1-mutated AML patients who also harbor one of these secondary mutations. So this is the purpose of the study, to examine, the co-mutation between NPM1 and one of these secondary mutations and see if there's any prognostic impact. So it's a retrospective study, multi-center, including Moffitt, Cornell, as well as Memorial Healthcare Systems. We identified a total of 233 NPM1-mutated AML patients. And among those, 43 of them also harbor the secondary mutations. So the main finding is that when we look at their overall survival, those with the secondary mutations have significantly worse, shorter overall survival. So we also did a subset analysis looking at just those who meet criteria for favorable risk ELN, and found that specifically if we are talking about the overall survival, those with the secondary mutations in the favorable risk ELN was 14.7 months versus those without the secondary mutations, median overall survival was not reached. Furthermore, we also looked at post-treatment MRD testing by PCR for those, for the NPM1 mutation, and found that those with MRD negativity predicted for longer overall survival compared to those with MRD positivity. And the finding is, confirmed again among those with favorable risk. So really, the overall, interesting finding is that this co-mutation, secondary mutations with NPM1 confer a significantly adverse effect on the survival of these patients. And, MRD negativity for NPM1 was associated with improved overall survival, even in the presence of secondary mutation, suggesting its importance as a prognostic factor across different risk groups.